good morning, everyone. Good afternoon, good evening if you are joining from any part of the world. And I would like to warmly welcome you to today's webinar. Start a career in adult care. What you need to know about adult care. So let me start by introducing myself. My name is Nova here. I'm an academic consultant here at South London College. And I'm absolutely delighted to be your moderator for this session. It's wonderful to see so many of you joining us today. So whether you are already in this particular path or maybe you're hoping to start something new, I believe you are at the correct place. Yeah. So let me just start with an introduction to tell who we are at South London College. So at South London College, we pride ourselves on being a well established professional online education provider in the UK. And we are dedicated to meeting the evolving employment needs for learners both in the UK and also internationally. So we are specialized in delivering high quality vocational training, employability skills and workforce, develop courses across a wide range of fields, like starting from adult care, health and social care, finance and IT, business management, and even beyond that. Also, we work with highly reputed awarding bodies such as NCFE Cash, ATHE, Focus Awards, PSM BTEC, and many more. So let's just quickly have a look at the agenda, what we have for today. So we'll be starting with an introduction to adult social care, types of roles, what you have there, skills you need, training and qualifications, and also an introduction to our courses as well, and also about the insights on the job market, how you should be able to start your career, and also in order to start your career, how we should be able to provide you the courses at South London College. And also we are going to talk about the career progression, and we have something very special for you, which are the offers and the discounts. And also we'll have a question and answer session at the end as well. So before we move on to the next slide, just wanted to give you a quick information. So you should be able to see the Q&A chat box on below. So if you have any questions, please do not hesitate. You don't have to wait until the last moment. You can drop all of those questions, but at the end, when we come to the part where we discuss about the questions and the answers, if it is an academic term question, definitely our tutor should be able to help you on those. If it is something to related to myself, I'll be very much happy to help you out. So let me just start with introduction for our tutor for today. So she is a highly experienced trained nurse with a background in district nursing, care of chronically and terminally ill patients, and rehabilitation, all crucial areas within adult social care. So since 2000, she have lectured on nursing, healthcare, leadership and management courses, and many more. So I would like to warmly welcome Sandie Bowden. Sandy, it's all up to take
Up to
from there
me.
itself.
So yes, thank you everybody. I reiterate what Noah said. Thank you very much for attending this webinar, and I really hope you take away a lot of things to give you food for thought and to help you plan your career. So first of all, I'd like to give you a little definition of what adult social care is. It refers to the support provided to adults who need assistance with daily living, and this might be due to age, illness, disability, or just general circumstances. So, the purpose of adult social care is to support and maintain independence as far as possible and make sure the adult is safe in their environment. So the support may include practical help, so things like personal care, and perhaps wider support for mental health and social activities. So if we look a little bit more in detail at the care provided, so personal care, this includes assistance with tasks like washing, dressing, eating, and if the client or patient is self-medicating in their own home, you might be asked to oversee that. Practical support might be help with household chores, medication management, and even shopping. It depends which context you're working in. Community and social support This refers to engagement in social activities, work or volunteering, and to maintain relationships. So this is a wider support. So you may be working in a daycare centre, for example, and that's the sort of context where this applies. Again, you may be providing support for specific needs, so help for people with learning disabilities, mental health problems, or physical illnesses. And there's also support for carers, so assistance and resources for family members and friends who provide care themselves. So, as you probably know, care can be provided in many settings. So it could be the client's home, daycare centres, residential or nursing homes. And the importance of independence and dignity and quality of life cannot be underestimated, and these are central to the effective delivery of adult social care. Now, a little bit of legislation here. The Care Act of 2014 reformed all adult social care in England, and it replaced most previous legislation for both those needing care and their carers. And the provisions included establishing pathways for assessing needs, providing local authorities with the duty to prevent or delay meeting those needs. So the idea is to promote individual well-being and putting adult safeguarding on a statutory footing. So this gives new carers new rights to assessments and support. The Act aims to give individuals more control over their care and ensure a consistent and high-quality system across England. The Care Standards Act 2000 is a UK law that reformed and regulated social care services, and it established a National Care Standards Commission, or you might see it written as NCSC. And this set national minimum standards for various care settings, including children's home, care homes, and independent hospitals. So you can see that overall, all contexts of adult social care are highly regulated, and they're governed by recent legislation, and the legislation is updated regularly. So if you look on gov.uk at these various acts, you will see new amendments. As things come to light, they make additional amendments and regulations to the legislation. So it's worth having a look at those types of legislation if you're thinking about going into adult social care. It will give you a good background of what the law says we must provide. Could I have the next slide, please, Noah? So why does it matter? So we've already said the purpose of adult social care is to facilitate independence and promote well-being, safeguarding and positive mental health. The UK population is ageing, with a growing proportion of people over 65 and a decreasing proportion under 20. Between 2011 and 2021, the number of people aged 65 and over in England and Wales increased by over 1.8 million, while the median or middle value age has risen from 39.6 years in 2011 to 40.7 years in 2022. The fastest growing segment of the population are those over 80 years. And projections suggest that this trend is going to continue. Now, those figures come from the Office for National Statistics. The NHS England site suggests that older adult admissions to hospital account for a large proportion of overall admissions, and this includes emergency admissions, and this is particularly relevant to the last year of life. Approximately 40% of all admissions are in the last year of life. As the number of people aged over 85 is projected to double by 2045, the demand for NHS services will also increase. Therefore, in order to help reduce the NHS burden, focus on providing more effective integrated social care is an imperative aim. So that means we're looking to increase care in the community, in patients' own homes, in daycare centres, to reduce that burden on the NHS. So compassion in the care sector has a definition of the act of treating individuals with kindness, empathy and respect to alleviate suffering and to build trust. So it involves more than just being sympathetic. It's an active response to a person's needs, and it includes emotional and physical well-being. Compassionate care is the foundation to person-centred services, and it fosters a sense of dignity, safety and connection for those receiving social care support. You may have heard of the 6 C's of care, and this refers to how care is delivered, intended to improve the quality of clients' life. It's compassionate, so empathetic, shows respect, kindness and dignities. It demonstrates competence, so being able to deliver care with underpinning knowledge and an understanding, having the right skills to do this. It refers to communication, or being able to listen actively to clients and work within a team, which is really important. And courage. Now this means doing the right thing, speaking up when you have concerns. And commitment, being committed to patients and clients and also our colleagues. So they're very important, the 6 C's.